everyone, my name is Janice Amil and I'm a student midwifery, and today I will do video reporting regarding about the natural and artificial methods. So before we will go to my topic, which is the natural and also the artificial methods that I will be gonna use, I will give you some brief regarding the natural and also the artificial methods. So the natural methods of birth control do not involve any medication or devices to prevent pregnancies, but rather rely on the behavioral about the woman's body and also the menstrual cycles. On the other hand, the artificial methods is very common use, include to preventing the sperm from reaching the ovum using condoms, diaphragm, and so on, inhibiting ovulation using the oral contraceptives, which is the pills, preventing the implementation using the intrauterine devices, killing the sperm by using the spermicides, and preventing the sperm from entering the seminal. So there are a lot of these options we can have in the natural methods, but I will tackle now the calendar methods. So the calendar methods help you to predict your fertile days by tracking the length of your menstrual cycles over the several months. So how can we use these calendar methods? But before we can use these calendar methods as a birth control, we need to track the length of our menstrual cycles for at least 6 periods. You can do this with a regular calendar. So first, we need to mark the first day of our period, which is the day 1, and then mark the first day of your next period, and count the total number of the days between each cycles. The number of days between the first day of each period. So you must chart this at least 6 cycles, so 6 periods. Okay, but counting even more, it's more accurate. To predict the first fertile day, which is when you can get pregnant, is in your current cycle. So first, we need to find the shortest cycles in your past record, subtract by 18 from the total number of days in that cycle, count that number from day 1 of your current cycle, then mark that day with an X, include the day 1 when you count, and then the day marked X is your first fertile day. So if your cycles are shorter than 27 days, the calendar methods will not be accurate for you, which is because you have an irregular menstrual cycle. And lastly, you need to predict the last fertile day in your current cycle. Find the longest cycle on your record, subtract 11 from the total number of days in that cycle, count that number from the day 1, which is the first day of period of your current cycle, and mark that day with an X, include the first day, the first day when you count. The day marked X is your last fertile day. Going to the artificial methods. So same as goes the natural methods. So the artificial methods also contain a lot of options, but for my reporting, I will be using the oral contraceptives. So the oral contraceptives, also called the birth control pills, which is the pills that we will be taking medications, are safe and reliable options for preventing the unwanted pregnancies. So how does these contraceptives pills work? So most oral contraceptives contain a combination of 2 types of hormone, an estrogen and a progestin. Both of these hormones are naturally found in a woman's body. There are many different types of estrogen and progestin, and the different types of pill contain different combination, but they all work similarly. Some pills contains only progestin, sometimes called mini pills. Here's the very important thing when you are taking the birth control, that you have to take it every day without miss. Kasi isang mali lang, you have 8% 8% of getting pregnant. But if you take without miss the oral contraceptives, or which is the pills, your percent of getting pregnant is 0.1%. So make sure if you gonna use this as your birth control, you have to take it every day and without miss. So okay, how does the oral contraceptives been taken? So oral contraceptives are usually prescribed for 4 weeks at the time, with each 4 weeks packet contain 4 to 7 days of hormone-free pills. Women get their period during these hormone-free days. Some preparation have extended or continuous hormone dosing, with fewer or no hormone-free days, so that women get their periods less than once a month. The oral contraceptives can be started any day of the week and any day of the menstrual cycle. All women should start taking oral contraceptive should first have the pregnancy test to make sure that they are not already pregnant. Women should also be use the backup birth control such as the condom for 7 days after starting. So you have to make sure that you are not pregnant during you take the contraceptive, which is the pills. Before you taking the pills, make sure that you are already taking a pregnancy test, which is the PT, so that it will be accurate for you, and also it will be safe if you are pregnant. As I already said earlier, the effectiveness of the birth control or the oral contraceptives perfectly 100% of the time. The chance of pregnancy is 0.1%. However, if the real world counting about missed days of use, the chance of pregnancies is about 8% every year. So make sure that if you're gonna use these methods, these artificial methods, which is the oral contraceptives, make sure that you always remember to take your medicines. So that's all, and thank you.